Well, good afternoon and welcome to H360 Live. My name is Dave Duplay. I am here in the studio with my colleague from Healthy O360, my friend, my consigliere, Miss Courtland Long. Courtland, how are you today?
I'm well, Dave. How are you?
I am fantastic. How about this weather we're having in New York?
Yeah, it's nice today, but it was pretty cold yesterday and the day before.
It was very cold the day before, I think.
Yeah.
Did you have a good weekend?
I did. I had a really nice weekend. I went apple picking on Saturday, and then, we went up for the Alzheimer's walk on Sunday, which was a great walk.
The walk was in Riverside Park. It was fantastic. The weather was great. We saw a lot of celebrities out walking for the cause.
Yeah, it was nice to see David Hyde Pierce out. He came and gave a little speech, which was very nice of him.
David Hyde Pierce is at every one of the Alzheimer's walks, and he's lost a grandparent to Alzheimer's, so he's very involved.
Yeah.
So it was a great walk, and the apple picking was good?
It was really good. Yeah, I went up with a couple of friends. The weather was really nice. The trees were changing, so it was a beautiful day.
Great. Well, we have a fantastic show for you today. Coming into the studio is Dr. Chernobilsky. He is a sleep apnea expert at Mount Sinai, Beth Israel. We're going to be talking about an innovative therapy from a company called Inspire. Really great innovative stuff going on there. But before we bring him into the studio, Courtland, as we always do, we've got some health tips.
Yes, we have some wonderful health tips to go through here, but this time, Dave, they're maybe not quite so strange.
Well, we've had these health tips that we call strange but true, and they're pretty fascinating. But this one is all about brain power, right?
Yes.
And what you can do to increase your brain power. Now, I've got it, when the doctor comes in, we'll ask him what he thinks of this health tip. But there's some great things going on here. So why don't you start us off and give us the first tip?
Well, I would love to, but first I would like to ask the audience, do you ever feel a little bit harebrained throughout the day? Maybe you're trying to cram too much information in, but it's important to really take a step back and try to find the roots of your confusion and your stress that is causing you to feel this way. And so our first tip is to handwrite your notes. And I love this tip because I feel like I do this all day, every day. I write everything down. I go into meetings, write my notes down. And so, when you're trying to remember too much information all at one time, it can be very stressful. But handwriting really helps to process that information into your memory.
Now, you do a lot of handwriting. I notice you have the green book you always take around to the meetings.
Yes.
Now, that's your to-do list, right?
That's my to-do list, yeah.
Now, I think handwriting your notes, it's much better than typing them on a keyboard in a meeting with your laptop.
Yeah, a lot of people do that, and I especially noticed it in school, but I think that doesn't necessarily help you truly process the information into your memory. I think there's certainly something tied to handwriting things down and really processing that into your memory.
I think so too, and I think it's very annoying, the clicking of the keyboards, when you're in a meeting and you're trying to focus and concentrate.
Yeah, but if someone's handwriting their notes and they have a clicky pen like I have here, they might have that really annoying habit of clicking things often.
I don't notice you doing that.
I don't do it.
But you do take a lot of notes.
Yeah.
That's great. The next one is practice your word skills, and this is one I really like. I want to get one of these calendars that has a word of the day on it, because I think that's great fun. You learn a new word, and then you try to incorporate that word into your, everyday meetings and, when you meet with friends. And that can be good or bad. You build your vocabulary, but then maybe a lot of people don't know really what you're talking about.
But then you might inspire them to also go out and do their research and get a word-a-day calendar. And the word-a-day is really great because you are getting your information in small chunks rather than trying to overload your brain with a lot of information.
Now, what about a crossword puzzle?
Yeah, I think crossword puzzles are great. They're wonderful memory building tools. When I was living in DC, I would do the crossword puzzle every morning on my commute into work.
Now, what about the Sunday New York Times crossword puzzle? Do you do that?
Whoa, that one is it's a little too competitive for me. That's like the gold standard of crossword puzzles, but the small little free paper in DC I was able to do.
Okay, very good. Do you have another one for us?
I do. So our third and final tip is to cook like an Italian. Now, this doesn't mean eating too much pizza, but this here we're talking about eating lots of fresh fish, vegetables drizzled with olive oil, and a little bit of meat, and a little bit of red wine. So people who are of the Mediterranean area are 36% less likely to develop the brain damage that leads to difficulty thinking and memory loss And a lot of researchers believe that this might be because of their diet.
Oh, I think that's absolutely right. Now, my grandmother was Italian descent, and you went into her house and she always had a pot of gravy on. You sat down and you ate from the minute you walked in to the minute you left, and there was always a jug of red wine on the table.
Well, I don't know that that's the diet they're really talking about,
it's
Dave. No, the fresh fruits, the veggies, fish.
There was always a lot of fresh fruits. There were a lot of figs, big on the figs, and so it was good.
Well, that's good.
Yeah. So, as we do every week, we send our interns out on the streets of New York to see exactly what our New Yorkers know about building brain power and all these helpful tips. You want to watch the video?
Would love to.
Okay, Maddie, roll it.
Do you have a tendency to take notes or just remember things offhand?
I prefer remembering things offhand. I take notes on the really important things or really specific details, like when I'm learning in the classroom, but for the most part, I prefer to listen and remember it myself and just take down the important details.
I typically take notes. For me, it's the best way to remember things. I think when you process things a lot better.
I definitely take notes. If I don't write it down, I'm probably not going to remember. I'm more of a visual learner than by ear.
How do you like to keep your brain sharp? Do you do crossword puzzles or Sudoku?
No, actually, I don't do either. The best way I'd like to keep my brain sharp, especially in the morning times, I feel like it's the most essential time of the day for you to always, be heightened and aware of everything.
I read constantly, just every day, either online or read a book. I also really like doing logic puzzles to keep my brain sharp. I prefer Sudoku than crossword puzzles. I like math more than writing.
So I think that the best way to keep your brain sharp is to always be reading. If you read, do Sudoku, and also I think going out and being active.
Does your diet have any effect on your mental health in terms of your memory?
I would say, yeah, probably, because sometimes I tend to eat a lot of fatty foods, a lot of food, like fried foods and things like that. And I don't feel like I'm working to my best ability when I eat unhealthy.
I kind of want to say yes. I feel like if you eat better foods, if you cut out a little bit more sugar, have more vegetables, I do think that it does affect you. It makes you a lot less sluggish.
I feel, I don't really know if it has a direct effect. I know eating blueberries is supposed to help you with Alzheimer's and things like that, but I know if you just eat healthier, your whole body will feel better, so I'm sure if you eat better, your mind will work better as well.
Courtland, what did you think?
Oh, I love that video. The one girl, she's very much like me where she writes everything down.
I think there were a couple of folks that they're big into writing down their notes.
Yeah, it's a really important and helpful tip. And then a lot of people really thought that your diet, is very influential on your memory and your brain power. So it's great.
I find that a lot of the New Yorkers that we talk to are very concerned about their diet.
Yeah, I think they are. In New York, it seems to be a pretty health-conscious city, so that's great.
We do a lot of walking.
Yes, we do.
We try to eat right.
Yeah.
So our interns didn't disappoint. Our friends in New York didn't disappoint either. Well, Courtland, now is our favorite time of the show. Our guest is here with us, Dr. Chernobilsky. He is the Director of Sleep Surgery at Mount Sinai Beth Israel. He helps patients who suffer from sleep apnea, a common condition that interrupts the sleep cycle. Doctor, welcome to the show.
Thank you very much.
It's a pleasure having you here. We have so much to ask you. This innovative therapy from Inspire. I personally want to ask you what you think about lavender, because I've got this little thing as we get into the show. I'm going to share with you my lavender spray. I spray on my pillow at night before I go to bed. Helps me sleep. Can wonder what you think about that. But there's so many things we want to know about sleep apnea. So, Courtland, let's get started.
I would love to. Well, Dr. Chernobilsky, again, thank you for coming in. It's a pleasure to have you. Before we really get started, can you kind of set the stage for our viewers and let them know what exactly is sleep apnea?
Certainly. So there's different kinds of sleep apnea that are either we generally break them down to central versus obstructive. Central apneas are basically when your brain doesn't tell your body to breathe. So apnea comes from the word, the Latin word for breathing, and it's the lack of breath. So in this situation, the brain just doesn't let the body know to breathe, and you have no breathing. In obstructive sleep apnea, your brain tells your body to breathe, but something's in the way. So usually it's your palate, your tongue, potentially your tonsils, and you obstruct your upper airway, and so air can't go from your nose or your mouth down into your lungs. So, and the particular kind of, my field of expertise is in obstructive sleep apnea, and that's the most common sleep disorder in the United States.
So is this considered a chronic condition? I mean, is there a certain age where you see sleep apnea present itself, or are you born with that?
So sleep apnea, well, obstructive sleep apnea runs the full gamut from early childhood to elderly. The causes are different depending on what stage of life that you might be in. In the pediatric population, the most common causes are going to be enlargement of the tonsils and the adenoids. Generally, between 2 and 5 are the largest size for the tonsils and adenoids relative to their head and neck anatomy. And so they're going to be suffering mainly from a physical obstruction. Everything else works, but they're just little and they have huge tonsils and adenoids. And so the most common procedure for them is going to be an adenotonsillectomy, or removing their tonsils and adenoids, and that's going to be curative. Now, some people, they don't, their tonsils and adenoids don't degenerate if they've had lots of infections, or they've had, their parents had huge tonsils and adenoids, and they don't go away. So adults will then also, especially younger adults in their teens, late teens, 20s, may present and have large tonsils and adenoids and need them resected. As you get further in life, a lot of us will put on weight. You'll have different ways of depositing your fat. And so some people that deposited more in their tongue or in their oral airway, and so they'll have a much smaller airway and will obstruct. And then as we get older, sometimes muscle tone goes down and we've gained some weight, and so it's more difficult when you're asleep to support your palate and your tongue, and so when that natural paralysis happens and loss of tone during sleep, people will obstruct with each breath.
Now, I'm sure some of the symptoms for sleep apnea are, snoring quite a bit and probably also feeling pretty tired during the day, but are there other symptoms that viewers should be aware of?
So it's interesting. It can present in many different ways. Snoring is a warning sign. Certainly, if a bed partner witnesses you holding your breath or gasping for air, if you've woken yourself up gasping for air, that's a very specific sign. Interestingly enough, daytime sleepiness is more it's not a hard, fast rule, but more a presenting symptom in men. Mm-hmm. Women will actually present more with insomnia. I have trouble sleeping or staying asleep, and the breathing pauses will actually, they'll be more sensitive to that. If you've had car accidents, if you drive, and New Yorkers don't drive so much, but they're responsible for a lot of construction, motor vehicles, subway. The Metro North disaster was an obstructive sleep apnea related issue. People remember the Exxon Valdez. So if, those kinds of things, memory loss, where did I leave my keys, and short-term memory issues, impotence, are all signs of obstructive sleep apnea.
So your breathing is interrupted. Is there other major health issues related to that other than just not getting a good night's sleep?
Absolutely. So we consider an apnea or a hypopnea a period lasting 10 or more seconds. And it's mild if it's more than 5 an hour. If it's more than 15 an hour, it's moderate, and over 30 is going to be severe. So obstructive sleep apnea has been linked to a lot of very serious illnesses. We know from studies that patients with severe obstructive sleep apnea that are not treated will have a 20% chance of just outright death within 6 or 7 years compared to their peers that don't have sleep apnea. And then on top of that, we'll have another 20% chance of having a heart attack or a stroke. So there's very significant life and health implications for having untreated obstructive sleep apnea. It raises your blood pressure on average 10 points in your top number and then 7 points in your bottom number. It's been linked to it's been linked to right-sided heart failure because of the low oxygen level that happens at the end of one of these hypopneas. You can imagine if you've held your breath for 30, 45 seconds, your oxygen level can drop to 60, 70. Now do this 100 times an hour. It's really a horrible workout for your heart.
Sure.
Yeah, that sounds pretty scary. Well, I know that people naturally snore due to a small obstruction in their airway, but how great does this obstruction really need to be before it's truly considered sleep apnea?
So I just in the previous just mentioned that definition. We consider a breathing pause of 10 seconds or more a true apnea. And then we consider something called a hypopnea, where you don't necessarily have to have a complete obstruction. You can have just very shallow breathing, and that lasts 10 seconds or more. And then they have an oxygen level drop of 4%, because during the sleep study, we're monitoring their oxygen level. So if we see somebody's airflow rate has dropped more than 50%, and their oxygen level has dropped 4%, then we consider that a hypopnea. And then we're also recording people's brain waves, so we can tell when they wake up. So we also have started recording these called RERAs, which are respiratory event-related arousals, which are snores or not true apneas or hypopneas, but basically breathing events that have caused somebody to awaken and disrupt their sleep, but didn't necessarily have an oxygen level drop.
So when I think of sleep apnea and what you can do about it, I have this envision of, I wear the big mask that makes me look like I'm a fighter pilot getting ready to take off. And now we've got this new innovative technology from a company called Inspire. Can you share with us a little bit about that technology and how that works?
So, great question. So Inspire is a company that has developed a hypoglossal nerve stimulator. And basically what that means is it stimulates the hypoglossal nerve. And that nerve is the nerve that innervates the tongue musculature, as well as some other cross talk with the palate. And so we've discovered that if you stimulate the hypoglossal nerve with an electrical signal, you can actually protrude the tongue, as well as stiffen the palate and strengthen the tone that normally drops during sleep. And so you basically have a little cuff that goes around the hypoglossal nerve that stimulates it, and a lead that goes to a stimulator that we put on the right side of the body in the chest, that then also communicates with a lead that goes between the muscles of the ribs. And so when somebody takes a breath, those muscles contract, and also the pressure changes in your chest cavity as you take that breath. And so what the stimulator does is it detects when you take a breath and then stimulates your tongue to protrude. And then that opens up the back of your throat and your nose and allows you to take a deep breath.
So when you say it's implanted, and I have a demo of one here, it's relatively small. And so where would this be implanted?
So this is implanted on the right side of your body, right pretty much below your clavicle, just not too high so it doesn't interfere with any movement. And it's one small incision, and it's pocketed right on top of your major pectoralis muscle. And it's really not that noticeable at all. In some patients, not noticeable at all. The scars heal very nicely. And then the leads are not visible at all because they're so thin.
Well, let's talk about the surgery a little bit more. You said it's one small little incision. So about how long does this surgery take? Are people put all the way under, or is it kind of more of a localized?
Right. So it's actually, for the whole procedure, it's actually 3 incisions. They're all in very cosmetic areas, and they generally heal beautifully. There's one incision that is at the level of the hypoglossal nerve that we put into a nice crease and hide it. And then we have another one, as we mentioned, for the stimulator, and then one on the side here to put into the intercostals. It generally takes about 3 hours, and it's under general anesthesia because we are working in a a fairly delicate area when we're in the level of the hypoglossal nerve. We don't want patient participation for that.
So it sends a stimulation. Now, this is only when the airway it senses it's obstructed?
So you get a remote control, so you turn it on at night, and then basically it's paced to your breathing. So whenever it senses a breath, it stimulates to open your airway.
Now, if I'm laying in bed and I turn this on, can I feel that stimulation or?
So some people do, but the mind has a great way of filtering things that happen repeatedly. And so if you're just laying there and not talking, or you may not even notice it. You might just feel your tongue against your teeth, something like that. But a lot of people will, there are stories of patients, getting up to answer the door, somebody's delivering something, and the delivery guy notices they're kind of protruding their tongue a little bit, but the patient doesn't notice. So, and obviously you turn it on only at night, and presumably you go to sleep, and you're not going to notice it then.
Mm-hmm. Well, let's shift gears for a moment here and talk about some of the collaborative projects that you and your team are working on. What are your goals, behind all these collaborations and the projects?
Right. So it's very important, as we talked about earlier, about all the different causes of sleep apnea, to really try to tailor treatment to the particular patient. Unfortunately, not everybody's built the same. Everybody has different anatomy. Everybody has different issues, and so it's hard to treat somebody as a one-size-fits-all. We mentioned positive airway pressure before with the masks. Those work 100% of the time if you use them. The problem is that they can be uncomfortable. Patients can have psychological issues. They can have claustrophobia, bad experiences in the past, and so they just can't wear it. And other people need to be walked through a surgery, or even picking what kind of surgery they need. And so the goal of all of our research is always to try to tailor-make the care for the individual, as opposed to just give everybody a particular kind of surgery or a particular kind of therapy.
I would think it's a lot about convenience as well, right? I mean, especially if you travel a lot, hauling that mask around and trying to, deal with that. And this seems like a great solution. Are there other solutions for sleep apnea? So we've got the mask, we've got Inspire's technology. What else is out there?
Certainly there are mandibular advancement devices, which are indicated for patients with mild to moderate sleep apnea. Those are basically devices that you wear in your mouth that protrude your jaw forward. They work very well. They have their own slight issues with TMJ. Patients that don't have teeth or have TMJ will obviously have a difficult time using them. And then, of course, we have surgery that we've been doing that is muscle rearrangement or augmentation. We have surgeries that will increase the size of your face. Those are called mandibular maxillary advancements, and those are also done for cosmesis, where we move the jaw and the maxilla forward, and that works very well. So patients have a lot of options for this, and the goal is to determine how bad is their disease, and then how to best pick the technology or surgery that's going to help them.
Mm-hmm. Now, how do you think that treatment and for sleep disorders is going to advance over the next decade?
So there's a bunch of exciting things. I think this is probably at the forefront right now. I think it's great. Other ways that I think it's going to develop, I think there's medicines that we're potentially going to develop that will augment muscle tone, that will improve that in more of the aging population, or people with musculoskeletal problems, nervous systems problems. I think I just saw a really interesting thing about hoseless CPAP, which uses little micro fans that you just wear it without any attachments.
And is that much quieter than the
Well,
other
actually,
one?
interestingly enough, the CPAP machines are pretty quiet. They're only loud when they leak. So when the mask slips, it makes a really loud sound. But actually, CPAP, if it's properly fit, is pretty quiet. So the older ones were quite loud.
Mm-hmm.
So if our viewers think they have sleep apnea or are not getting a good night's sleep, they're waking themselves up, they come to see you, what's the process? Do you put them through a sleep study first and examine what's going on? Walk us kind of through the typical process.
Right. So let's start with an adult. I mean, an adult, it's with kids, it's a little bit different. But if an adult suspects they have obstructive sleep apnea, obviously we're going to get a full history. We're going to determine, is this obstructive sleep apnea or is this some other, because a lot of times patients don't know they have obstructive sleep apnea, they just know they can't sleep. So is this restless leg? Is this insomnia? Is it narcolepsy? Or they're tired during the day? Is it idiopathic hypersomnia? So my job is to first just to determine clinically what I think is going on. And if I'm suspicious that there's obstructive sleep apnea or something like restless leg, etc., then I'm going to send them for a sleep study. And now we have both home testing and in-lab testing. And a lot of patients find it much more convenient to do it at home. The lab does give us a lot more information that's useful, but for uncomplicated obstructive sleep apnea, the home study is a good tool. After that, we determine the severity, and then based on the severity, the patient's anatomy, and their goals and what their needs are, whether they travel a lot or what technologies or therapies they're willing to undergo. And you go through all the things, and then my job is to make sure that whatever they pick, they're successful with.
Well, Dr. Chernobilsky, at Healthy 360, we love takeaways. So if there was one major thing that you wanted our audience to take away from this episode today, what would that be?
I think the most important thing is that a lot of people suffer from sleep disorders. It's a third of your life should be spent sleeping. New York is especially a tough place because of all the pressures on you. So if you're not feeling rested and if you're not performing well, you really should get checked out and screened. And that if you do have sleep apnea, there are a lot of great new options that, and if you failed in the past, we have stuff that can help you. So, come in and we can help.
Now, you talk about the home study, right? So is that something like wearing a Fitbit on your wrist to measure, your sleep? How does that work?
So there are different types of devices, but there is one just like that. It's called the WatchPat. Not that I'm endorsing any particular technology, but it basically measures your pulse pressure and your oxygen level through a handheld device. And they use an algorithm to determine whether you're sleeping and what's going on. There are other devices that are in line with more traditional stuff where you're wearing a sensor on your nose and your mouth that determines your airflow, and then a band around your chest that measures excursion. So if your chest is working really hard but there's no airflow, then you're obstructing. And then they usually include an oxygen level sensor.
Now, before I let you go, I have to ask you, I sleep really well. I get about 3.5 hours a night. I'm the kind of person that when it's time for me to sleep, I lay in bed, I say it's time to sleep, I close my eyes, I'm out. 3.5 hours later, I wake up, I'm refreshed, I'm feeling great. But before I close my eyes, I spray my pillows down with this lavender spray. Do you think that has something to do with the quality of sleep I'm getting?
So I think that everybody should have a wind down routine. And so your lavender spray is part of your wind down routine. That tells your brain...
Are you telling me it's the placebo effect?
No, I'm telling you that you're not having a placebo effect.
Okay.
That you have made a routine for yourself that includes this. Just like if you have a little kid and you're trying to get them to sleep, you know that they have a glass of milk, they brush their teeth, you read them a book, and their brain knows that, hey, it's dark out, this is my routine, it's time to sleep.
Yeah.
So whatever it is that you're doing that's working for you, except for the 3.5 hours sleep is not enough, but that's part of your routine. And so that signals to your brain that it's associated with good sleep, and that's what it wants to do. It's not placebo, it's actually good sleep hygiene.
Okay. I told you.
Hey, but I told you 3.5 hours is not enough.
Not enough.
You did. Well, Doctor, thanks for coming in. Unfortunately, that's all we have time for today. I would, however, like to invite you back because this is a fascinating topic and one that I want to learn more about. So thanks again for coming in. I'd like to thank the viewers for tuning in, and I'd like to thank our sponsors for making this all possible. Remember, all of our episodes can be viewed on demand at healthyo360.com, and our podcast can be found in the iTunes store. Courtland?
Well, we love social media, and we're all over Facebook, Instagram, Twitter, and Pinterest. We use that hashtag #RealStories when posting, and we'd love it if you would do the same. So on behalf of Dave Duplay, myself, and the entire Healthy 360 family, We'd like to thank you again for joining us. We hope you have a great day, and we look forward to seeing you again next week.